Hi, I'm Susan Taylor with Scripps Health in San Diego, California. The placenta is an organ that develops inside the uterus during pregnancy. Placenta previa is a problem that occurs during pregnancy when the placenta completely or partially covers the opening of the uterus, and this can cause severe bleeding. Joining us to talk about how to diagnose and treat it is Dr. Daniela Gomez. She's an obstetrician and gynecologist with the Scripps Clinic Medical Group. She specializes in maternal and fetal medicine. Doctor, thanks so much for being with us.
Thank you so much for having me, Susan. It's a pleasure to be here today.
So, go into a little bit more detail about the role of the placenta during pregnancy.
The placenta is an organ that develops inside the uterus during pregnancy that helps provide nutrients and oxygen to the baby. It also is in charge of getting rid of the waste that the baby makes.
And what is placenta previa? Can you explain that in simple terms?
Yes, I can actually. So I have a diagram here, and you can see that this is the uterus where the baby develops, and the placenta is covering this opening to the uterus, which is called the cervix. When the placenta is over that cervix or partially covering it, we refer to it as a placenta previa. Typically, you want that placenta to be away from the opening of the cervix.
And is that the umbilical cord that's there?
Yes, the umbilical cord comes from the placenta and then inserts into the baby, and that's how we get the nutrients and the blood flow into the baby.
So, what causes placenta previa and who is most at risk?
Currently, we're not exactly sure what causes a placenta previa, but we do know that certain women have higher risk factors for developing the condition. Certain things, such as being 35 or older at the time of delivery, having a pregnancy that was conceived using in vitro fertilization, if you have more than one baby inside your uterus, so you're carrying twins or triplets or more babies, if you've had a previous uterine surgery, such as a cesarean section, or if you've had multiple pregnancies before, all these things increase your risk factors for a placenta previa.
And so, what are the most common symptoms that patients might notice?
Most placenta previas are asymptomatic, meaning that they don't have any symptoms. However, some women may experience some painless vaginal bleeding when they have a placenta previa.
And can placenta previa go away on its own as the pregnancy progresses?
Yes, many of the placenta previas that we see at the 20-week ultrasound that we do tend to resolve, though not all of them.
And so, if it's not resolved, what happens?
If the placenta previa has not resolved, then mom will need a cesarean section for delivery at 36 to 37 weeks. The reason for the earlier delivery is because we do not want mom contracting against the vessels of the placenta that are over that cervix, which would increase her risks of bleeding.
How is placenta previa diagnosed?
Placenta previa is usually diagnosed using ultrasound. Typically, we pick these up at the time of the anatomic survey, which happens anywhere from 18 to 20 weeks, usually.
And so, how do you treat it?
Placenta previa doesn't have an actual treatment, but we do follow the placenta previa throughout the pregnancy. And so we do some ultrasounds to see if it is moving out of the way. And then we make sure that we keep track of mom to see if she's having any bleeding or any contractions.
So, when should somebody call their doctor right away if they suspect placenta previa?
Typically, women with placenta previa will have been told that they have it with an ultrasound prior, but if you don't know and you haven't had an ultrasound and you are having heavy vaginal bleeding, it's always important to call your doctor and seek immediate medical attention.
So, beyond placenta previa, what is placental abruption and how does it differ?
Placental abruption is a medical condition that describes when the placenta, which again is located down here, separates prematurely from that uterus. Now, you don't need to have a placenta previa to have a placental abruption. The placenta could be located anywhere in that uterus and it could still separate. The things that we get concerned about with placental abruption is that if that placenta separates from the uterus, you are going to have heavy bleeding, contractions, and it may affect the well-being of your baby.
So, what are the warning signs of placental abruption that women should know about?
Placental abruption oftentimes will present with bleeding, though not always. And then sometimes people will have severe abdominal pain, really frequent contractions. Potentially, you might be feeling pain in your back. Those are the biggest things that we would note with a placental abruption.
Are there other placental conditions that patients should be aware of, like what is accreta or retained placenta?
Yes, there are several conditions that can affect your placenta throughout pregnancy. A placenta accreta is when the placenta is abnormally stuck to that uterus. Placental insufficiency is when your placenta is not providing adequate nutrients to the fetus for one reason or another. And a retained placenta happens after delivery, where that placenta is also a little bit stickier than expected, and a piece or the whole thing may be stuck to the uterus and needs to be removed after.
And so, what advice do you give to women who are diagnosed with placenta previa or these other placental complications?
For any woman that is diagnosed with a placental abnormality or a placental complication, it is very important for her to make sure she maintains all of her medical visits and ultrasounds. Ultimately, we want to be able to follow what is happening with that placenta, and the best way for us to do that is with ultrasound and with checking in regarding symptoms.
Because how important is that placenta in terms of the health of the unborn child?
I like to refer to the placenta as the life support system of your baby. While your baby is still in your uterus, that placenta is responsible for everything your baby needs. Therefore, that placenta is very important, and the health of the placenta is directly linked to the health of your baby.
So, how can maternal-fetal medicine specialists like you support patients through what is, I guess, a high-risk pregnancy?
Maternal fetal medicine specialists, such as myself, make sure that we are doing the ultrasounds that are specialized to take a very good look at that placenta and give you all the information you will need throughout the pregnancy. We are also here to monitor your symptoms along with your obstetrician and help coordinate the delivery timings and any other medical visits that you and your baby will necessitate throughout the pregnancy.
If you have placenta previa, how much more often are you going to see your doctor for these ultrasounds or any other tests during your pregnancy?
It varies from person to person. However, oftentimes you'll have at least two additional ultrasounds to check in on that placenta and its location.
Any final thoughts, doctor?
As I previously mentioned, that placenta is responsible for your baby's health while you are still pregnant. Therefore, any abnormalities with your placenta require for you to be followed very closely by your doctors. If you suspect that you have a placenta previa or you've been diagnosed with one or any other placental issue, it's important for you to follow up with your doctors very closely and monitor for symptoms such as painless bleeding. If you are having painless bleeding or severe abdominal pain, you must contact your doctors immediately.
Doctor, thanks so much for being with us. We appreciate you taking the time.
It was my pleasure to be here. Thank you so much, Susan.
If you want more information about placenta previa, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.